Hi, I'm Allison and this is Josie. For my regional interdependence exam, I'm going to be assessing her CT junction as I think this is a cervical issue and the CT junction is a common site for hypomobility, which can definitely affect thoracic and cervical mobility. I'm also going to be assessing PAVMs, cervical PAVMs on the left side because I think this is a neck mobility deficit case. I definitely, for future reference, I would look at the thoracic spine as well as the shoulder. I could do thoracic PIVMs and PAVMs for assessing rotation. I could also do inferior and posterior glides at the glenohumeral joint just to get a really good idea of everything. Hi Josie, I'm going to be assessing your CT junction. The CT junction is just a meeting point where your cervical and your thoracic spine come together. It's a common place for hypomobility, meaning lack of movement, and so that can really affect how your neck is moving. So I'm just going to assess that, okay?
Yep.
You're going to go ahead and turn around for me. And I'm just going to be placing my hands on your back. Is that okay?
Yep.
So my landmarks are going to be C7, and how you can find C7 is find the bony prominence. You're going to have them extend their neck and relax. If that mark does not move, you know you're on C7. However, if when they extend their neck, it disappears, you know you're on C6. So I'm going to scoop the skin to take up the slack and put my thumbs now on the TPs of C7 and T1. Scoop up the skin. I'm going to get eye level, and I'll have my arms out a little bit more, but so you can see a little bit better, I'll have them down. What I'm looking for is when she turns, my thumb should move inferiorly on the ipsilateral side. All right, Josie, I'm going to have you turn to the right for me. Any pain with that? Go ahead, look straight, look to the left. Any pain with that? We'll do that one more time. To the right, good, and to the left. Okay, go ahead and turn around for me. So Josie, my thumbs, when I have them placed, what I should see is them moving. When you look to the right, there's not really a lot of movement. However, when you look to the left, I do have some movement. So there's nothing wrong with that. However, we do want to increase that mobility, okay?
Yep.
My next assessment, I'm gonna have you lay on your back. I'm gonna now be assessing PAVMs, which is the accessory glide. So Josie, I'm gonna put my hands around your neck, on the back of your neck, okay?
Yep.
Just assessing your motion. So I'm gonna put my MTP on the lamina of her cervical spine. I'm gonna be assessing the lower cervical as I think that is what's gonna be causing, or that is what I think is gonna be hypomobile. So again, I'm gonna scoop up the skin to get the slack, and then I'm gonna apply a diagonal force from the shoulder to the opposite hip. And I'm just feeling for that end range. Josie, you doing okay?
Mm-hmm.
I would do both sides, but for the purpose of this video, I'm going to stick to the left since that is what the chief complaint is. All right, Josie, when I was assessing your neck, I felt a little bit of stiffness going along. Again, there's nothing wrong with that, but we do want to increase that mobility, which is really going to help you when you're doing your functional movements, when you're going back to golf. It's going to make things a lot easier and help with pain, all right?